M.M.C. International, your partner in the fight against drugs. A customs officer tests one of the swallowed packets by means of the cocaine test, recorded at one of the largest European airports, which has already been using the M.M.C. test for many years. In order to accelerate the reaction, a spatula is used to mix the substance with the granules. The blue discoloration indicates the presumptive presence of cocaine. The main advantages of the M.M.C. tests are no dangerous liquid reagents, safe and easy to use, acid neutralizers are not required, no environmental risks or concerns, one-step tests, one ampoule only, results within seconds, high reliability and consistency, accurate and sensitive, economical, low cost, easy to test liquid narcotics and precursors, no hazardous shipping concerns, no concern of over or underloading the ampoule with suspected drugs. Presumptive tests. Each test contains one or more chemical agents that develop into a specific consistent color when agitated in the presence of certain substances. The simple color-based approach is the easiest way in the field to identify controlled substances. While not entirely 100% proof, the tests can help the officer with making some presumptive findings. These findings then allow the officer to make an informed decision as to probable cause, arrest. When a specific color appears, a positive identification can be assumed and the officer can take the appropriate steps within the context of the situation. In almost all countries, narcotic field tests, including the M.M.C. tests, are considered as presumptive tests. Test results cannot be considered proof positive, conclusive, or evidentiary. The presumptive test results can be considered to be a component of probable cause. All substances should always be forwarded to a forensic lab for qualitative analysis. In some jurisdictions, the results of the M.M.C. tests are considered proof positive in a correctional setting, as the M.M.C. tests are extremely accurate and inmates have already forfeited some civil rights. For more information, please check your applicable laws. Testing procedures. Testing procedure falls into the following sensible categories. Classify the material to be used, such as tablets, capsules, powders, crystals, granules, flakes, plant materials, gel, liquids, or other substances. Select the proper test for the substance to be tested. Determine the proper amount of substance to be tested. Perform the test. Interpret the result. Dispose of the used test kit. An exact color match is not required. In other words, red is red, blue is blue, and orange is orange. Preparation of suspect material. Prior to introducing any material into the M.M.C. test, it's important to properly prepare that substance for the best possible reaction in the test. Always use disposable gloves and new spatulas when handling suspect-controlled substances. Capsules. Holding the capsule between thumb and index finger, twist it to separate the two halves. Extract a small amount of substance and introduce it into the M.M.C. test. Tablets, chunks. Reduce the tablets or chunks into small fragments, preferably powder. Introduce a small amount of the fragment into the M.M.C. test. In case of unknown materials, always use the general screening test first. The possible color reactions are printed on the box of the general screening test. We advise using the M.M.C. ID wall chart as a guideline. Opiates amphetamine test. The opiates amphetamine test is a double test for identifying, for example, heroin and morphine and amphetamines. Remove the cap from the ampoule. Break the tip of the ampoule at the marked breaking line and place the ampoule in front of you. Use a clean spatula to put a small amount of material into the ampoule. After the material to be tested has been introduced, a purple discoloration will indicate the presence of heroin. Amphetamines will cause an orange-red discoloration. Place the plastic cap back on the ampoule. Preparation of suspect material. Crystals, granules, powders. Introduce a small amount of the crystals, granules, or powder into the M.M.C. test. Mix the powder substance before introducing it into the ampoule. This will make sure that cutting agents and controlled substance are blended, so your sample will include a controlled substance, if any. Cocaine crack test. The material can either be introduced into the ampoule with the help of a spatula or be put directly into the cap. A blue discoloration indicates the presence of cocaine. In case of crack, the discoloration will take a little longer to emerge. Plant material. For dried marijuana, reduce the plant substance to an equivalent of 3 strands of tobacco. For fresh plant tests, clip off a small piece of a 1/4 inch and introduce it directly into the test. Cannabis test. For the cannabis test, the cap contains a small dose of powder. This powder must be introduced into the ampoule together with the material to be tested in order to achieve a complete reaction. A red discoloration indicates the presence of cannabis, THC, such as marijuana, hashish, or hash oil. Liquids. Introduce the liquid into the M.M.C. test with the help of the supplied spatula. Use the round end of the spatula or use a mini pipette to introduce a drop of the liquid directly into the M.M.C. test. GHB test. You can introduce the material to be tested into the ampoule with the help of a mini pipette or with the round end of the spatula. A green discoloration indicates the presence of GHB, gamma hydroxybutyrate. GBL test. This test falls under the precursors test category. The presence of GBL, gamma-butyrolactone, will cause a deep blue discoloration. In addition to many drug tests, M.M.C. also developed a number of precursor tests, such as the GBL tests, ephedrine test, PMK, BMK test. Precursors are the components used in the production of various drugs. Narcotics identification tests. General screening test. Cocaine crack test. Opiates amphetamine test. LSD test. Cannabis test. GHB test, gamma hydroxybutyrate. Prime test, general screening test. Pentazokine test, Talwin. Heroin test. Methadone test. V&R test, Valium Rohypnol. Ketamine test. M&H test, morphine heroin. Cocaine odor test. Crystal meth/XTC test, ecstasy MDMA. Methaqualone test. Oxycodone test. PCP test. Barbiturates test. Precursors test. GBL test. Ephedrine test. PMK-BMK test to differentiate PMK from BMK. MCPP test. Field test case. Frequently used to have the most important tests available on location and in squad cars. PNIC, Party Narcotics Identification Case. This case is especially developed for testing substances in the club scene, dance events, etc. DRE test. Specially developed for drug recognition experts to make it possible to perform a large number of analyses on location. M.M.C. precursor test case. This case has been specially developed for testing precursor substances such as ephedrine, GBL, acetic anhydride, ammonium chloride, sodium carbonate, and many more. M.M.C. testing guide. In case of unknown materials, always use the general screening test first. We advise to use the M.M.C. ID wall chart as a guideline. The M.M.C. testing guide is a procedure whereby an unknown substance is subjected to a series of progressively discriminating tests. If all of the tests indicate a positive reaction for a particular substance, there's a high degree of certainty that the substance is what the guide indicates. In other words, 2 tests are better than 1 test, 3 tests are better than 2, and so on. There are 3 major benefits to the testing guide. 1. It minimizes the chances of false positives. 2. It gives a starting and stopping point for testing. And 3. It allows for a high degree of accuracy. The testing guide works by eliminating what the substance cannot be. After several tests have been run on the unknown substance, the presumptive identity of the substance can accurately be determined. Using this guide greatly enhances the probable cause environment and any subsequent action you might take. To be more accurate, you can use the M.M.C. forensic narcotic tests specified on the poster as FT testing. M.M.C. forensic narcotic tests. The M.M.C. forensic tests are especially developed for an extra confirmation in inconclusive cases or in diluted or impregnated substances such as a controlled substance in beverages or in genes, etc. Unscrew the white closure of the M.M.C. special buffer solution container. Place a small part of the solid or tablet in the container of the M.M.C. special buffer solution. Note, cannabis, THC, and tablets or chunks leave the bottle for 4 to 5 minutes before testing. Traces on surfaces. Wet the cotton swab in the buffer solution bottle and rub a few times on the surface to be tested. Immerse the cotton swab in the bottle and mix the substance on the swab with the buffer solution by rotating the swab between the fingers. Close the M.M.C. special buffer solution container tightly and thoroughly shake the M.M.C. special buffer solution container for some seconds. Open the pouch of the test cassette. Grasp the buffer solution container in one hand and snap off the tip so it becomes a dropper. Apply 4 drops into the round opening of the cassette at 5-second intervals to achieve the best result. Wait until the red lines appear, 2 seconds to 5 minutes. Do not read the result after 10 minutes. Advantages of the M.M.C. presumptive forensic narcotic tests are very sensitive. able to detect the presence of drugs in a sample at levels of less than 1 part per million, or ppm. Quick results, visual in 1 to 2 minutes. Specificity M.M.C. FNT tests versus GC/MS. Negative 99.38%. Positive 97.45%. No hazardous chemicals. User-friendly. Highly cost-effective in comparison to laboratory screening. As reliable and accurate as laboratory screening. No cross-contamination, as each test is supplied with a separate dropper of special buffer solution. The stick is attached to the cap. The M.M.C. presumptive forensic narcotic tests are CE approved. Forensic tests for the presumptive detection of methamphetamines, ecstasy, MDMA, barbiturates, buprenorphine, benzodiazepines, cocaine and crack, methadone, morphine, opiate, heroin, phencyclidine, PCP, cannabinoids, THC, oxycodone. Contents of the M.M.C. forensic test case: 10 M.M.C. forensic tests, 10 M.M.C. special buffer solution droppers, 10 cotton swabs, separately packed, 10 spatulas, 10 evidence bags, 1 permanent marker, 1 instruction sheet. Categorizing analytical techniques to achieve the evidence. Recommended by SWG Drugs Scientific Working Group for the analyses of seized drugs. Techniques for the analysis of drug samples may be classified into 3 categories based on their discriminating power. The table provides examples of these techniques listed in order of decreasing discriminating power from A to C. The analytical techniques marked in red will be sufficient for evidence in court. 1.4 BD butanediol GBL GHB test strip. M.M.C. received many inquiries from their customers to develop a test which is able to detect 1.4 butanediol. The advantage of this test is also that you can differentiate 1.48D, GHB, and GBL as the precursors look alike. Cocaine trace wipes. These wipes have been developed in cooperation with customs and police authorities to identify traces of cocaine on, for example, baggage, containers, car interiors, etc. Cocaine identification spray. In close cooperation with police and customs and excise authorities, M.M.C. International developed a handy, safe spray to identify cocaine impregnated in textile, cartons, plastics, etc., but also traces of cocaine on all kinds of surfaces. Advantages: easy to carry with you, safe and easy to use, no environmental risks, no aerosol gas, fast field test, results within seconds, approximately 25 to 30 tests per ampoule. The applicator can be used multiple times. It's a very economic field spray. M.M.C. rapid urine tests. M.M.C. International BV has been the manufacturer of presumptive narcotic tests for many years. Recently, M.M.C. developed urine drug tests in accordance with the forensic standards. The M.M.C. one-step urine test is a rapid one-step lateral flow chromatographic immunoassay test for the qualitative detection of many controlled substances and their principal metabolites in human urine at specified cutoff levels. The M.M.C. rapid urine tests are for in vitro diagnostic use and for professional use only. Single cassette, strips, 25 per box, tube. Tests available: amphetamine, barbiturates, buprenorphine, benzodiazepines, cocaine, methamphetamine, MDMA ecstasy, morphine, methadone, opiate, phencyclidine, tricyclic antidepressants, marijuana, cannabinoids, oxycodone, ketamine, propoxyphene. Urine collection cup, 100 per carton, sterile PP, polypropylene. including label and sterile security seal, only available per carton of 100 cups, 4-ounce, 100 milliliter urine sample cup, sealable lid, graduated marking in ounces and milliliters, sterile interior, sterile seal for integrity, label seal for writing. M.M.C. Narcotics Tamper Evidence Bag. These bags are intended for use with confiscated drugs. Use the specialized plastic bags for handling narcotic evidence. Serialized control number on all bags. Removable receipt includes control number. Integrated tamper-proof seal. Writable surface for incident documentation. Other remarks on the back. Ballpoint pen can be used to write on bag surface. 6 by 9 inches, 15 by 24 centimeters. 1,000 bags per carton. Portable drug scale. Law enforcement professionals routinely weigh seized illegal drugs because criminal drug charges are usually based on the weight. We are now offering our customers an affordable way to accurately measure illegal substances in the field and to shorten the time required for processing suspects and evidence. Our digital scales are extremely compact, allowing officers to carry and use our scales in the field where they're needed the most. Drug ID Bible. The 600-plus page Drug Identification Bible is a comprehensive reference for identification of all drugs, from prescription drugs to illicit street drugs. Hundreds of new full-color photos, comprehensive tablet and capsule ID, controlled prescription illustrations, comprehensive definitions, educational content, illicit drug photos, concealment methods, slang glossary. Excellent for training and field use alike. Tested and approved by police forces, Forensic Science Service in the UK, Customs and Excise Authorities, Airport and Border Police Forces, and so on. M.M.C. International BV has been awarded with ISO 9001-2000 and is GSA scheduled. This is a part of the production laboratory in Breda, the Netherlands. Only high-purity reagents and special coated granules are used in the process to achieve the best results. The test ampoules contain a blanket of high-purity nitrogen to secure a long shelf life. The production capacity of the M.M.C. narcotic ampoule tests is 7,000 to 8,000 ampoules per hour. M.M.C. provide narcotics officers, DREs, or officers of any other law enforcement agencies to obtain an M.M.C. Basic Competency Certificate. You may need to provide the certificate to the court to show them you are certified to use the M.M.C. presumptive narcotic tests. There are 2 ways of obtaining the certificate: online through our website, narcotictest.com, or offline through a certified M.M.C. narcotic test instructor.